Radiology is demanding work. It requires a cool head, sharp focus, and strong attention to details. Dr. Dan Cousin of Tampa keeps his mind focused at work by juggling for his patients, especially the little ones. And as you'll see, his results are nothing short of magical.
Hello. What brings you here today?
Dan Cousin is a medical maverick. A Harvard-educated radiologist, he takes a unique approach to maintaining focus at work while helping children feel at ease before their appointments. He juggles.
Anything that physicians enjoy outside of work that's appropriate to bring in some way, shape, or form into work is a good thing. I'm not the best juggler or magician, and some people see me perform and say, don't quit my day job. So I didn't. I just incorporated magic and juggling into my day job.
Cousin started juggling in high school, along with his younger brother Joey. Before long, they were entering competitions and receiving international attention.
From Tampa, Bay, Florida, Dan and Joey Cousin, the Cousin Brothers.
At one point, we were actually second place in the world at the 1995 International Juggling Competition in Las Vegas. We became known as the Cousin Brothers because our last name is Cousin, and we're brothers.
At Harvard, Cousin co-founded the Harvard Juggling Club to encourage others to try their hand at it. One day, even Harvard President Neil Rudenstein got into the act.
The motto for Harvard is Veritas, which is the Latin word meaning truth. So our shirt's motto for the Harvard Juggling Club was Gravitas.
Today, Cousin is clinical director at BayView Radiology in Tampa. Sometimes you'll find him juggling at work between patients, a routine of sorts that helps him de-stress as he juggles his busy patient schedule with the demands of his practice.
As a physician, we face a lot of stresses in this day and age that I think have never really been there before that make it more difficult to practice. So anything that makes it just a little bit more fun is a good thing.
Wow, that was the longest you did. Good job.
Being a patient, the whole experience of it, the stigma of it is not something that's desired by anyone, I think. You have to go into a hospital or a doctor's office. You have to get into your gown, take off work. I think that anything that physicians can do that would make the experience just a little bit more positive is something that is our responsibility to try to do.
Cindy Nation, BayView's Senior Director of Operations, says Cousin's juggling has been well received by patients of all ages.
Nobody expects to have that type of entertainment in a sense, and especially from a radiologist, you know, so it makes it so much more calm. People are appreciative because, you know, they're bringing their children here. You would think that someone may consider that, well, should I take him seriously because he's actually doing we never have that effect at all. We always have the positive effect. It's nothing but positive with this. So it's very enjoyable, and not only our patients enjoy it, their loved ones that come with them, but also our staff. It makes it a very fun environment.
Cousin also dabbles in magic, a gift that is a surefire hit with kids.
Well, I always look for opportunities to do juggling or magic for pediatric patients. They really enjoy it, and sometimes I even teach them how to do simple tricks. They say that a great magician never tells their tricks, but I'm not a great magician, so it's okay. And after I teach them how to make a paper float or something kind of simple, like a simple disappearing object, I see them trying to do it, and I know they're just going to go home and teach their friends or show their friends. It's, in a sense, I feel like I'm enabling them to believe in themselves that they could do something that they previously didn't think they could.
So I'm going to tell you the best feedback that you can get is a child saying, "Oh my God, he's so cool." That is such feedback, and you see the smiles on the parents' faces, and just even patients that don't have children, it's just a big smile. A lot of people love it. They really do. It's great.
But whether he's juggling his work with magic or working his magic with juggling, Cousin believes there's a time and place for each performance.
I developed a sort of system for when it's appropriate to juggle. Any kid under the age of 12, absolutely, it's appropriate to juggle and do magic. Any adult who happens to have their kid with them at the appointment, often appropriate. Any grown-up adult patient who is dressed as a clown, probably appropriate. Any patient who is having a procedure at that moment and then taking out the machetes to juggle for them, probably not appropriate. Unless you've sterilized the machetes with an autoclave, and then completely fine.
A lot of radiology work is done in the dark, which Cousin says helps physicians better read their patients' images. Juggling, he adds, helps to keep him alert and focused when reading and interpreting patients' studies.
Obviously, that's very important as a physician. Radiologists, for example, have to be able to pick up subtle findings, early cancers, and whatnot. Also, it's very important to have good coordination as a juggler. I personally would prefer my physician doing a procedure to know how to juggle. Even if they're not juggling during the procedure itself, of course.
As a parent, Cousin has found that juggling and magic have a practical application for him at home.
There's nothing that makes a toddler stop crying faster than doing a little juggling or magic trick. I think it's misdirection, because in magic, you're trying to misdirect the viewer from one point to something else. I think it's misdirection with my toddler, because she might be crying about something, and I'm just distracting her and saying, hey, look at this trick.
So when you can relate to a child and you can calm their fears by connecting with that child, that's so key. That's so key. And he loves to do it. And the feeling that, you know, that connection that you get, the child can feel that. You can see it. You can actually see it. You can witness it. And that's amazing. That really is. It's so important to be able to do that. And he's just a natural. He's a natural at it.
Hey! Thank you very much. We'll be here all week, and I'm on call on Thursdays.
For more information on Dr. Dan Cousin, visit BayViewRadiology.com/Tampa-MRI-radiologist.